Hi, so I'm Tim Martin, and today we're going to be talking about a couple of the different drug families that are used to treat asthma. So first and foremost, we got the disease background, and that's that asthma is a chronic respiratory disorder that's caused by inflammation of the airways. It's acute episodes of bronchoconstriction that result in tachypnea, wheezing, and shortness of breath. The pathology of asthma is such that inhaled allergens cause this inflammatory response, that's dominated by IgE-bound mast cells, which then produce mediators that cause bronchospasm, increased mucus production, and increased need for leukocytes. This is a spiraling loop effect as the leukocytes release more mediators, which release more IgE to bind with the mast cells, and so on. There are lots and lots of pharmacological options that we use to treat asthma. The two families that I'm going to be talking about today would be first of the beta-2 adrenergic agonists, which are your typical rescue inhalers. And then the second family is going to be the leukotriene modifiers, which is a very, very different kind of drug that's used to treat asthma. So, as far as the beta-2 adrenergic agonists go, these are your rescue inhalers. Albuterol, levalbuterol are the medicines, ProAir, Ventolin, things like that. Those are called short-acting beta agonists, and there are also long-acting beta agonists, which just basically work twice as long as the short-acting ones do. The mode of action of these medicines is that they relax the smooth airway muscle. They have very rapid onset time, and they usually provide 4 to 6 hours of relief. There aren't any drug interactions to speak of, but patients who use them can expect a brief period of tachycardia and tremors to go along with the relief that they're going to get as their airway opens up a little bit more. In terms of efficacy, they're a great short-term fix, but they don't have any anti-inflammatory properties, and so you're going to find that typically people are taking steroids, if they can tolerate them, to go along with the inhalers. And then the expected outcomes, of course, are the relief of the acute symptoms of that asthma exacerbation that they're having. Now, the other family that I chose to talk about is the leukotriene modifiers, and those are used for the prevention of those exacerbations of asthma as opposed to treating any kind of current symptoms. So those medications are montelukast or Singulair as we know it, and then zafirlukast. And the way that these medicines work is they block the cystenyl leukotrienes, which cause the bronchoconstriction and promote mucus secretion that leads to the asthma exacerbations in the first place. There aren't any drug interactions to speak of with these either, although there is an idiosyncratic syndrome that a very few patients will get from this that causes heart failure and vasculitis, so that's something to look out for. The efficacy of these medications, the leukotriene modifiers, is that they are preventative. They're not for acute attacks, but especially children who take them on a regular basis may have less and less exacerbations, provided they're not put in the wrong environment. And the expected outcomes are that they prevent those acute flare-ups that then necessitate steroids and inhalers and breathing treatments and all that other stuff. In terms of genetics, environment, and lifestyle, there are lots of different kinds of asthma. Many of them are linked to environmental factors, more so than genetics, although there can be some genetic link. Industrialized areas, especially in the West, have many more pollutants and irritants that cause exacerbations of asthma. And while there are some genetic links, like I said, it's mostly attributed to environment and lifestyle, especially when children whose lungs are developing are exposed to smoke, secondhand smoke, and other pollutants, which can lead them to have a lifelong problem with asthma. So, in order to prevent asthma, either in yourself or in children, first rule is don't smoke. And especially don't smoke in a locked car with your kids riding in a trapped booster seat in the back seat. Go outside, stop, whatever you can do. So, two kinds of medicines. Beta-2 adrenergic agonists, those are the typical rescue inhalers that we see all the time. And then the leukotriene modifiers, which are preventative. Thanks for listening.